Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar and today's lecture regarding gastroenterology is IBS, which is also known as Irritable Bowel Syndrome. Irritable bowel syndrome is also referred as nervous colon or anxiety of the gut. Irritable bowel syndrome is an important disease because of its high prevalence and high morbidity. In the US, approximately 12% of patients that are seen by the primary care physicians have irritable bowel syndrome. And usually in GI practices, more than 1/3 of people or the patients, they have functional GI disorders. And usually irritable bowel syndrome is around the most common diagnosis. So basically in this lecture, we'll be reviewing the knowledge of epidemiology and the pathophysiology of irritable bowel syndrome. And we'll be seeing the rational basis of the diagnosis and the therapy. So, by definition, what exactly is irritable bowel syndrome? Irritable bowel syndrome is characterized by the presence of abdominal discomfort or abdominal pain, which is associated with disturbed defecation. So, bloating is also one of the symptoms that is usually present, but it's not an essential symptom for the diagnosis. We've seen that there are a lot of criteria to diagnose irritable bowel syndrome, but the Rome criteria that was created, it has a sensitivity and a specificity of 71 and 85% respectively. So if we talk about the Rome criteria, it has Rome 1, 2, and 3. And if we talk about Rome 3 criteria to be specific, it is characterized by the recurrent abdominal pain or discomfort, which is present at least 3 days or 3 months in the last 3 months, and it is associated with 2 or more of the following. So one, it could be associated with the improvement of this pain with defecation. Second, it could be that it is improved with the onset of the change in the frequency of the stool, and the third is the onset of the change in the form of the stool. So there are 3 more criteria that we're supposed to be thinking of, and it's supposed to be consisting of either of these 3, which is supposed to be 2 of these 3 or more of these. So this is the Rome criteria.